Good evening, everyone. Thank you for joining us tonight at the HIP Annual Community Forum. We're very excited to have you all here with us tonight. Bienvenidos a todos. I want to send a special welcome to our students from the Watsonville Health Academy. Thank you for joining us tonight. I also want to send a warm welcome to our parents from the Cradle to Career Live Oak program. My name is Elisa Orona. I am the Executive Director of the Health Improvement Partnership, Santa Cruz County. And it's my pleasure to get this exciting event started tonight. And really just to start with some thank yous. Mi nombre es Elisa Orona, soy la directora ejecutiva de HIP y es un placer esta noche empezar con unos agradecimientos. Thank you to everyone for coming tonight and for making health improvement and health equity and community a priority in your busy lives. Gracias a todos por venir esta noche en el espíritu de salud comunitario y colaboración. So tonight wouldn't be possible without an amazing team. This is the team that I have the pleasure of working with every day at the Health Improvement Partnership. And you probably know them. Wait, nobody saw that. You probably know them as the committed, dedicated professionals here in the community that work with all of you to elevate community health and equity. You probably also know them as this crazy bunch. Bring them up. Oh, they're not changed. There they are. Yeah, and I just want to say that we have such a great time working together, and tonight wouldn't be possible without them. And if you see them walking around, please say hi because they are fun and they are very friendly. So, yeah, thank you. Esta noche solo es posible con el apoyo del equipo de HIP y son profesionales muy divertidos, muy amables y muy dedicados. I would like to thank our event sponsors. We couldn't do this without the support of the Hospital Council of Northern and Central California. They've supported this event since I started here in this position, so I so appreciate Joe Cafaro and the Hospital Council. Also, Sutter Health and Palo Alto Medical Foundation, Dignity Health Dominican Hospital have been strong supporters of this community forum. We also have new forum sponsors. You could just go back real quick. Our new forum sponsors are Lighthouse Bank, our local community bank for HIP. We really appreciate their support, as well as Five Branches University, which is a local institution that's focused on acupuncture and traditional Chinese medicine. So thank you to all of our event sponsors. We also have table sponsors tonight. Our table sponsors have made tonight's event, we've been able to invite more community members and had our ticket prices at a place where we could invite as many people as possible, so we have a full crowd, as you can see. So we thank Santa Cruz Community Health Centers, the Cradle to Career program, Kaiser Permanente, and Salud para la Gente for their sponsorship to the tables tonight. So can we give a round of applause? Thank you. So on behalf of the HIP team, I also want to extend a thank you, appreciation to the HIP Board of Directors. The Health Improvement Partnership wouldn't be without the vision and the commitment and investment of the Board of Directors of HIP. And really the time, the energy, the investment that they make in community health here in Santa Cruz County, really making health equity, really making the safety net a focus point for all the health providers in the community. This is unique, it's special, it's something to be celebrated. And I so appreciate you all being here to do that with HIP tonight. And so I'd like to recognize our chair, our board chair, Stephanie Sonnenschein, who's joined me on stage tonight, also CEO of the Central California Alliance for Health. We thank the Alliance for the support and leadership and really appreciate it, Stephanie.
So again, I'm Stephanie Sonnenschein. I'm the CEO for Central California Alliance for Health. And as I said, we are the health plan for people in Santa Cruz County who have Medi-Cal coverage. And I'm also serving this year as the president for HIP Exec. And it's a real pleasure and joy to work with an organization whose purpose is to bring healthcare leaders in a community together to work to improve the health of the community. And my job is really easy tonight. I have the best job, which is just to welcome you all to the 2019 event. This event that HIP sponsors each year, this community forum, is just one example of the opportunities that HIP staff and council create to bring people together to think about healthcare, to think about wellness in our community, to share information, and to look towards how we can improve. And really my participation in this organization, and I think from the Alliance's perspective, is such a bright spot in the work that we do. It's not typical of a community to pull leaders from all different organizations and to get people from the community who may not otherwise work in problem solving in healthcare together in forums like this, in forums like HIP Council, in different kinds of community events and educational settings. And so it's such a unique and special thing what the HIP staff, what the HIP Council does, what the Safety Net Clinic Coalition does, unique and special, as Elisa said, to have that resource in our community to really focus on improving health. And so we are so pleased to be able to participate in HIP and to support events like these. I really find a lot of joy in that work, and I find it to be so energizing for me to have the opportunity to focus on improvement. I find it really inspirational. And so my hope for you all tonight as you're here is that you are similarly energized and inspired and motivated to pursue action to improve the health of Santa Cruz County. So again, I'll end with my easy job, the best job of the night, which is welcome. I hope you enjoy.
Good evening. My name is Leslie Goodfriend, and I work for the County Human Services Department. And it's an honor for me to get to speak to you tonight about our Cradle to Career initiative. Live Oak is a home to multi-million-dollar houses, yet there are pockets of poverty interspersed within just blocks of each other. At Live Oak Elementary School, 85% of the children are on free or reduced lunch, and a quarter of the students are characterized as homeless. To address these challenges, the Live Oak Cradle to Career initiative was formed in 2014 by parents, educators, health, and social service leaders working together to ensure that all Live Oak children can reach their full potential. We sought the leadership of parents to guide the initiative from day one. We asked parents what their hopes and dreams were for their children, and they told us they wanted good health, good character, and good education. To be successful in engaging all parents, we added our next ingredient, authentic inclusion in all that we do. By shifting from a service model to an organizing model, our Cradle to Career initiative sees our parents as partners. We don't wait for parents to come to us, we meet them where they are, at the school or in the community. The parents are strong advocates for their children and families, changing the trajectory of the young people of Live Oak to ensure the vision of Cradle to Career is realized, that all Live Oak students are happy, healthy, and ready to succeed in school, college, and career. Live Oak School District is proud of recent academic data, which shows the percentage of Live Oak third graders demonstrating proficiency on the state's English Language Arts test has increased over the past 3 years, rising from 51% in 2015 to 66% in 2018. And this is greatly surpassing the state average for 2018 of 48%. And now I'd like to invite Supervisor John Leopold to present the Community Collaboration Impact Award to the Live Oak Cradle to Career Parent Leadership Committee. Supervisor Leopold has championed an upstream approach that encourages and leverages families' trusted connection to their school and health center. He understands the intersection of education and health and recognizes the importance to remove barriers to keep our sectors siloed, resulting in a streamlined cross-sector system that puts families at the center and in charge of all components of their well-being.
Thank you, Leslie, and thank you to the Health Improvement Partnership for having this award to be able to share it with some true heroes and leaders in our community. You know, when we started thinking about what this program, Cradle to Career, would be, we had great partners around the table. The County Health Services and Human Services were involved, the Live Oak School Districts, importantly the Santa Cruz Community Health Center, which had just opened up in Live Oak, the First Five, and Encompass. But as talented and creative as those organizations are, we found that when we actually listened to parents, when we had parents lead, that's where we saw the greatest benefit. You're about to meet a group of women who have shown me so many different ways in which they are true community leaders. They have advocated for legislation that increase subsidies for child care services. They have advocated to create a food bank program, the Passion for Produce program at the Live Oak School District. They have advocated to create a better healthcare system and better healthcare connections for their families, for the school district, and for the health center. These are the kind of folks that we should be lifting up every day, because I know that in my role as a policymaker, when we listen to the community, we do our best work. And when we listen to parents about what they want for their kids, they will always make good choices. And when we can leverage the resources that we have, we can see great outcome that Leslie just shared with us. So please, let's welcome the Parent Leadership Committee of the Live Oak Cradle to Career program. So before I hand over the microphone, I have a proclamation to give to the Parent Leadership Committee that thanks the Parent Leadership Committee from the County of Santa Cruz, the entire Board of Supervisors. I'm just representing them tonight to thank the Cradle to Career Parent Leadership Committee for their leadership and contribution to the children's and family and Live Oak community. Thank you for your work.
Hola, buenas tardes. Es un poco emotivo para mí, pero las lágrimas se me salieron. Es muy bonito y disculpen.
So Diana is going to go ahead and continue to read her message to you tonight, and then after she's done, I will then translate.
Hola, buenas tardes. Mi nombre es Diana Valadez y soy madre líder de Cuna Carrera por 3 años seguidos. Gracias a todos por estar aquí y escucharme. Yo hablaré hoy de la salud. Quisiera compartirles un poco de los logros que hemos venido obteniendo poco a poco. Yo soy una persona que lucho día a día por mi salud y bienestar, para estar fuerte para mis hijos y para mi familia. Estoy sufriendo hace 1 año 5 meses de una enfermedad llamada mastitis en mi seno derecho. Una situación muy dolorosa, y lo peor es que no sé cuándo terminará este sufrimiento. Y conversando con otras madres de familia, ellas también empezaron a abrir su corazón y platicar sobre sus problemas y necesidades. Quizá platicaban con más confianza porque somos una comunidad de madres fuertes, con grandes corazones y sentimientos vulnerables. Fue ahí donde, al escuchar tantos testimonios, se me ocurrió la idea de comentar con el equipo de Cuna Carrera y ver si se podía brindar apoyo a las madres que no tienen un seguro médico ni los suficientes medios para poder costear los gastos necesarios. Se formó un comité de salud y entre juntas y pláticas, hoy en día hay varias agencias que están trabajando y brindando su apoyo para nosotros. Gracias. También quiero comentar del programa Pasión por los Productos, que se formó a raíz de una junta que tuvimos para preguntarnos qué era lo que la comunidad necesitaba. Entonces opiné que sería bueno que, como ya teníamos clases de Zumba en nuestro programa, era de buena idea que nos proveyeran clases de nutrición y pudieran darnos ayuda con los productos que ofrece el banco de comida. Me da gusto compartirles que hoy en día llevamos recibiendo estos beneficios poco más de un año. Clases de Zumba, clases de nutrición y repartición de productos. Y alrededor de 60 a 70 familias somos beneficiadas 2 veces por mes. Y estoy orgullosa de saber que escucharon mi voz. Esperamos seguir creciendo y desarrollar más actividades para seguir manteniéndonos activos a nosotros y a nuestros hijos. Esperamos seguir contando con su gran apoyo y así nuestra comunidad seguirá creciendo y formar más lazos entre unos y otros. Gracias a todos, especialmente a las agencias que nos han ayudado, Primero 5, Kaiser, Distrito Escolar, la Clínica de East Cliff, el Condado, Fundación de la Comunidad, Encompass, Banco de Comida, Centro de Recursos del IVOC, y en especial quiero dar el reconocimiento a Alison Guevara. Es un gran motor para seguir nosotras aquí de pie. Gracias por todo, por ayudarnos, por nunca dejarnos y por siempre guiarnos por un buen camino. Gracias por el reconocimiento y gracias a las madres que nunca me han dejado solas. Gracias a las madres que nunca me han dejado solas y que han apoyado siempre, siempre han apoyado mis ideas. Gracias, gracias John Leopold y gracias a todos ustedes por escucharme.
Good afternoon. Can you hear me? Yes. Good afternoon. My name is Diana Valadez. I'm a leader and a mother from the Cradle to Career. I've been involved for 3 consecutive years. Thank you all for being here and for listening to me. I'm going to talk tonight about health. I would like to share with you a little bit about the accomplishments that we have come to make possible slowly, one step at a time. I'm a person that has fought every day for my health and well-being so that I can be strong for my kids. And my family. I am suffering today for 1.5 years now from an illness named mastitis in my right breast. This is a very painful situation, and the worst of it is that I don't know when the suffering will be over. In my conversations with other mothers and families, they too have opened their hearts and begun to share about similar problems and needs. Maybe they talked with me because they feel trust, because we are one community of strong mothers with big hearts and vulnerable feelings. It was from there, after hearing many of their testimonies, that it came to me, the idea of creating this team of Cradle to Career to see if we could give each other support as mothers who don't have medical insurance or enough resources. to make living in this area possible. This committee was formed, and after conversations and gatherings with various agencies, we are now being supported by them. I also want to comment that the program, Passion for Produce, that was formed after one of our meetings, because we had questions about what the needs were in the community, it was at that point that I shared my opinion that it would be good that we were already doing Zumba classes, and that it would be a great idea that we receive nutrition classes and that we could receive vegetables that the Banco de Comida, thank you, that Second Harvest Food Bank provides. I'm very happy to share with you today that we have been receiving these benefits for more than a year: Zumba classes, nutrition classes, and vegetables. About 60 to 70 families receive these benefits twice per month. I am so proud to know that you are hearing my voice. We hope to keep growing and developing more activities to continue the activities with our kids. We hope to continue also with your support, your great support, so that our community can keep growing and forming more partnerships. Thank you to each of you, especially First Five Kaiser, the school district, East Cliff Clinic, the county, the Community Foundation and Compass, Second Harvest Food Bank, the Live Oak Resource Center. Allison, a special thank you to you for always guiding us and believing in us and never leaving us alone. Whew. That's when she started speaking from the heart, and I'm with you with that one. Thank you for this great acknowledgement.
Okay, continuing in that vein, to recognize people that are really making a difference. My name's Leslie Connor. I'm with the Santa Cruz Community Health Centers. Hi, Allison. So it is my distinct honor to recognize Dr. Salem Magarian, a beloved and respected pediatrician with a 40-year history of improving health, innovating care for children, and advancing social justice in Santa Cruz and across our hemisphere. Now, I have a lot to go through because he has a long CV. It is long. It's not as long as the Mueller report, but it's pretty long. So, here goes. Salem was born and raised dirt poor, his words, the son of a preacher in Florida. He attended Emory University thanks to a scholarship from Coca-Cola. He'll tell you about that. He attended Harvard Medical School, and he took a life-changing year off to provide medical care in rural Guatemala, what he calls his formative medical training. Salem spent his residency at the University of Utah and was named outstanding teacher in his class, whereupon he spent the next 12 years practicing in Salt Lake City, ending up as medical director at the University of Utah's Primary Children's Medical Center. While at the university, he started an exchange program between its Department of Pediatrics and the University of Guatemala Pediatrics Department, which lasted 20 years. In the early 90s, Salem made his way to Santa Cruz, where he became pediatric medical director at Dominican Hospital. Inspired by his compassion for children and his innate creativity, Salem began a long journey in our community that included opening the Dominican Pediatrics Clinic to increase access for poor kids, but which evolved into a medical home for our most complex and at-risk children. He brought the NICU to level 3, ensuring that local babies could stay in Santa Cruz for treatment as opposed to journeying over to Stanford. He also helped bring Stanford subspecialty clinics to Santa Cruz, improving local and regional access to critical services. Salem's collaboration with Dominican, Lucille Packard Children's Hospital, First Five, and the county resulted in the Foster Care Neurodevelopment Clinic, bringing services to one of the highest risk youth populations of all, creatively uniting specialists under one roof in a patient-centered model. Page 2. I got to tell you all of this. Okay, so one of the highlights of Salem's career has been the innovation of a multidisciplinary program for drug-exposed infants that cut NICU length of stay from 14 to 9 days. He has seen over 300 of these children thrive and grow over the years, many of whom are in high school now and are still his patients today at the Eastcliff Family Health Center. Because of this experience, Salem is now working as a medical director at the Alliance to ensure the whole child California Children's Services Program succeeds. Salem has been a First Five commissioner since 2006, and he's been a clinical leader in the Live Oak Cradle to Career program, as well as C2C's community care team, which unites clinical providers with teachers and counselors to share a care plan for at-risk children. Okay, so the common thread here is Salem's passion for his work. He loves and respects the children and families he works with, and they him, regardless of their circumstances or struggles. As senior pediatric advisor at the Santa Cruz Community Health Centers, Salem is enthralled by his patients' stories, which usually include struggles against enormous odds, extreme poverty, parental addiction, immigration threats, and complex medical, social, and emotional needs all rolled into one child. The dignity that he ascribes to families is one of his most innate strengths. He doesn't judge, he doesn't resent, he heals with positivity, hope, and an infectious joy. So many of us in this room have been inspired by Salem's commitment to children. I can't say he is the Santa Cruz Community Health Center's pediatrician alone. He belongs to all of us. A local treasure working to lift up the lives, health, and opportunity of our brightest hope, children. So for all these reasons, and on behalf of HIP, myself, Salem's patients, his coworkers, and all of us in the room, and with the clear understanding that you're not done yet, I'm thrilled to present you, Salem, with the 2019 Champion for Health Improvement Award.
Okay, that'll do. This isn't the Late Show with Stephen Colbert. That'll do, okay. Wow. Thank you, Leslie. I'll try to live up to that. And I guess I'll follow your orders. I'm not done yet. We'll figure out what the next chapter will be. Several of you have asked, well, so can you say something about how this all happened, or what goes on to your head? How do you plan what you're going to do next? Because to me, it only makes sense if you look backwards. I mean, who knows what's next, but every one of my career choices, I think, has sort of been preparing for the next one. So I'd like to go through and tell you a little bit about it. First, a few individual thank yous. First, my love and life companion, Lori. You mean the world. Thank you. And my oldest daughter, Louisa, who is here as well. Thank you, Louisa. Now, she's had the uncanny ability to be my most sage career counselor. From an early childhood, she would just listen to me ramble. She says, well, it sounds like. So thank you for your lifetime advice. And Leslie, I'd like to say, you're the best boss ever. And what I can say about Leslie that makes her the best boss is not just her perseverance and her dedication, that she actually understands neurodevelopment. She can give my talks better than me. I mean, if you're talking about epigenetics and you're talking about just the whole ball of wax of how brains development, how the environment shapes it, why drug babies can do fine with the right environment. She knows the science, and she has the mission, and she knows how to keep the doors open. So it's an amazing thing in a boss. So thank you, Leslie. I could probably thank everybody in the room, but just a few special thanks. Now I'd like to say two incredible providers that mean the world to me, both physician assistants, Eileen Donnelly, who I worked with. I worked with her for the last 15 years or so at the Dominican Pediatric Clinic, and I'm just so honored that you have chosen to stick with me, cover my tracks, give me advice, enable me, all the things, because you know all of the sort of improvisational, not attention to detail sides of what I bring to the world. And so she has the ability to tell me when something's not quite right, when I'm coming in low for a landing. So if anyone out here has to give me negative feedback, just go through Eileen. She's got it down, and very kind. The other is my best friend, and that's Morgan Stryker, who is here. And Morgan also works with us at East Cliff. We have an incredible team, but I first met Morgan 25 years ago in the back room of Westside Clinic. And he was one of the founders of Westside Clinic. This is really back in the day. But we were at the end of a busy day, just talking and trading stories and just really finding each other and bonding and realizing we were really connected. We had the same view of the world. It's just, I had come from Harvard Medical School, and he came from dancing in a men's existential theater troupe in the woods outside of Ashland, Oregon. But we had it down. And one of the things that he has done for me and for all of us is he's been a sounding board. Every one of the programs that Leslie outlined, he heard about at least a year in advance. Somewhere in the Redwoods or in southern Utah or the Sierra, he would hear me just go off on these impossible dreams, and we'd sort of shape it, drop it, bring it back or something. So thank you, Morgan, for all you've done. Another provider who can't be here, another provider that can't be here, but I just wanted to acknowledge him because many of you know Wells Shoemaker. He's probably the most genius pediatrician of all time, real Renaissance man. I came to Santa Cruz in '92 and met Wells. Everybody assumed we were going to work together because, oh yeah, we're just sort of the same, and we figured that out right away. And if we're the same, you don't want to work together because you never get to spend time together. So we didn't work together, but we had this odd deal that just evolved about 5 years later because he was the first medical director at the Alliance, right when managed medical was coming to be. And I was a fledgling medical director at Dominican trying to figure out what to do. And so we got together once a month in his office and we played pediatric poker. And his cards were all the policy cards. And I had all the program cards. And so we went back and forth, and I don't think people really fully appreciate that's how a lot of these programs came, because nothing works if you can't fund it. So that's enough of the thank yous. Let me tell you a little bit of the story of sort of where I came from. And being a pediatrician, I'm always interested in nature and nurture, and it all starts with your folks. So there's mom and dad. They're no longer with us because they were both in their mid-40s when I was born. I was, spoiled very much, and was the fourth in the family. I'd just like to say a couple of characteristics of what they were like. My mom spoiled me to death, taught me that every day would be a great day, and avoid conflict at all costs. So you can see there's sort of a mixed message there. Okay, now my dad, on the other hand, he was hyperactive, hypersocial, very impulsive, always wanted to fix things and make things better. That sounds a little bit familiar. But anyway, I had a very happy childhood until I had my, I had a very happy childhood. But here is an interesting historical note that talks a little bit about healthcare innovation. This is a picture of baby Howard at 10 days of age coming home from the hospital after a normal spontaneous delivery. That was what happened back then. 10 days in the hospital and you get a ride home. So life was good, but life always has trauma and adverse child effects. Adverse childhood events happen. and it happened to me. That's a little sad, Howie. That was my first name. At about 2 years of age, I was separated from my parents. My family was quarantined for 5 days, and I was put in the Miami Children's Hospital for polio. I didn't have polio, but I was put in the hospital, and after a few days, they figured out, whoa, back. After a few days, you can see the little splint there. They figured that I had an infection in my hip. And as many of you know, I walk on 2 artificial hips and now an artificial knee that I got last month. It all started with this. But I was separated from my parents for a long time, and I assume it made a little scar in there that I've been covering up for the last 65 years. But the rest of childhood was fine. School was fine. Emory was fine. And even though I did get a scholarship from Coca-Cola, I didn't have to recuse myself for 5210. I said, go for it. Go for it. You take the money. And I don't know how I got into Harvard Medical School, but I will say this. If you're fortunate enough to get into Harvard Medical School, you can coast and maybe even go downhill for 40 years and still make it. So, let's see. So that formative year that Leslie was talking about happened in rural Guatemala. It was a town called San Pedro La Laguna that probably some of you have gone to now, because in the day, it didn't have any electricity. You could only get there on a boat 3 days a week. There were 5,000 people. Infant mortality in that area was 10%. Under 5 mortality was 30%. Malnutrition infections were rampant, and they never had a Western doctor. And I was plunked into their town, and there's me in my first office. It says, Consultorio, Dr. Salem Magarian, Medico Practicante. And they just made up the term and put me there. Those were the days. So how do you practice in a situation where there's millenniums of tradition that you don't have a clue about? And almost very few people in town speak Spanish, speak in Tzotzil, the Mayan language. And that's how it was learning. It was so humbling and so honoring and so interesting and so amazing. How could you ever think that I have something to offer in that environment with no lab, no x-ray, no colleagues, very limited medicine, no phone to call Stanford? It was, so what do? So this is my medical assistant translator who had never gone to school. And holding this, it looks like a crucifix, is the older sister. And this, I think, as I look at these pictures, she has a look of trauma. It reminds me of that little boy we were just seeing. And it turns out she had the same infection, except hers was in her elbow. And you can see her left elbow. So what do you do in San Pedro in 1974 when there's nothing to do? You do surgery. Oh. Wow. So enough for San Pedro. That was quite a year. I did have to go to some of the surrounding villages, so doing my Che Guevara look-alike, I got my motorcycle and traveled around some of the other villages. So anyway, that was the year that made me want to be a pediatrician, because I went to Harvard. Everybody's an internist at Harvard. That's the way it was back then. So I said, okay, I'm going to be a pediatrician. So I went to my advisor, told him the news. He says, great. Get an internal medicine residency and have a family. You'll be all set. And so I decided to go to the University of Utah for my pediatric residency. As many of you know, there's a lot of babies in Salt Lake City. Yeah. So it is a fabulous training program. And I'll tell you why. Because the level of pediatrics in Salt Lake is sky high. So good. And the program was geared toward primary care doctors. But the faculty members were top-notch because the Children's Hospital is the only children's hospital between Denver and San Francisco and Phoenix and Calgary. So their transport area was enormous. They invented air transport in the 70s, and the number of fresh cases we got. So one of the big lessons I learned there at Primary Children's Hospital was specialty care, primary care, opposite sides of a coin, equally valuable, totally dependent on each other. totally respected on both sides. That really stuck with me, and I think of that today. The other thing is I learned as I became medical director there is if your best friend works twice as hard as you and is promoted to be your boss, it's time to get out of Dodge. And so that's when I came to Santa Cruz. The real reason is my former wife was given an endowed chair at the university, so I came here. So she sat in her chair, and I was dumped at the front door of Dominican Hospital, not knowing what to do. I was the baggage. So I came along, didn't know what to do, but I realized I was a little bit like my dad. I was a program builder. And so I was medical director of the NICU and realized that we were sending babies to Stanford. Okay. And the other thing I realized, our ER was clogged with babies. We couldn't take care of heart attacks and strokes and all kinds of stuff because there are babies with ear infections. What's the deal here? And so I came up with these plans. Let's make a level 3 nursery. Let's make a pediatric clinic. Great ideas, but I went to present them to Sister Julie, and there came the lesson. No margin, no mission. Think about it. You got to pay for it. And I figured that when you're selling a program, if you sell the CFO, you're done. Because you got the great program, but you need the CFO to sign off on it. And so the NICU was easy. Okay, we know that. But what about the other program? The other program, we said, I was told, if you can raise the projected losses for the first 2 years, we can open that pediatric clinic. Oh, okay, it's $250,000. Took 2 hours to do that. One was lunch with Mary and Dick Solari, community heroes. Dick's no longer with us, but the Solari family, thank you. In 1 hour, they said, okay, we'll do half of that, wrote a check. And the next hour was the Packard Foundation said, we like that. And so they was off to the races, and we started the clinic. But when we started the clinic, it was for all those healthy kids that didn't have a place to go. Well, who came? All the kids with chronic care, all the kids with CCS, the ex-preemies, and then eventually it turned out to be the perfect place for all the babies that were narcotic exposed, drug exposed, and so we ended up getting this tremendous amount of expertise with very complex kids, and particularly the drug exposed babies. But how did we figure out what to do with the drug babies? Because there was no consensus, there was no standard of care. And it started one day, and I see Susan Holly back here, I think you were there that day. We were sitting doing our multidisciplinary rounds, and all realizing this is complete chaos. We're not talking about the baby, we're talking about our feelings. And what we need to do is, what would we all do differently to make things better? Because we had labor and delivery, we had pastoral service, we had pharmacy, we had OT, everybody was there, and everybody said, well, everybody came up with something they would do differently. And we decided, well, let's do it that way. And that's as simple as way. There were no grants, there were no permissions, there was no proposal. We just all changed our behavior. And it worked, thanks that Alliance was covering for those things. And wow, the savings. Okay. So we did that. We started the foster care system, and then in the last few years, we've been at East Cliff, and it's been a pleasure. And here's who we see here. This little Leo has permission to use this slide. He's getting his 5th heart surgery next week at Stanford, and his mom was brave enough to talk to Kaiser Health's News to tell what it was like to be illegal here, taking care of a special needs kid, fearing at times that there would be deportation. She's been here for 23 years, but it was really marvelous. Here's a 23-weeker, no prenatal care, 110 days at Stanford, and now is almost 2 years old, adopted, doing beautifully. Here's another little boy, drug exposed, adopted, ADHD, sort of some autism, and once again, doing well with the most dedicated family in the world. So it's all about working at East Cliff. So I like it a lot. You've seen the bookends. You've seen the bookends of my career, particularly Guatemala, East Cliff, my 2 best jobs. I don't think I'm going back to Guatemala. I don't think we're going to become a sanctuary clinic for all those kids at the border. But if any of you out there want to join in with Morgan and Eileen and me, Leslie's down here taking resumes. We'd love to have you. And I'm going to quit now. I know we ran way over my time. I just sort of into it. But as long as I sort of have you here, I did want to channel my father, who, as you know, I'm a son of a preacher from the deep south, and I've always wanted to say it in front of a big group. Shout hallelujah, say amen.